Every time I walk into an operating room these days, it feels a bit like I've stepped into a sci-fi movie. Robotic arms, high-def screens, it's wild to think how far surgery has come.
It's almost surreal, isn't it? Those robots aren't doing the surgery on their own, though. That always surprises people. There's a real surgeon behind every move, just with a lot more precision than before.
Definitely. And I think the biggest misconception is that the robots are making the decisions. In reality, they're more like an extension of the surgeon's hands, super steady and accurate, but always under human control.
Yeah, and speaking of control, the setup is pretty fascinating. Surgeons are often sitting at these specialized consoles, moving joysticks and pedals to guide the robotic arms. It's almost like playing a video game, but with much higher stakes.
That makes me think of the Vinci System, probably the most famous one out there. But there are some newer names popping up too, like Vercius and Hugo Ross. The tech is evolving so fast.
Totally, but the basics are actually pretty consistent. There's a patient-side cart with robotic arms, those miniaturized instruments, and that 3D high-def vision system that lets surgeons see everything in amazing detail.
That 3D view is a game changer. Surgeons can magnify the area up to 10 times, spotting tiny nerves and vessels they might miss otherwise. It's like getting a superpower for your eyesight.
And the movements. The robot filters out hand tremors and can make really fine-scaled adjustments. So even if a surgeon's hand shakes a little, the robot's arm stays steady as a rock.
Funny enough, when people hear about robotic surgery, they usually think of fancy heart operations. But these systems show up in so many fields now: urology, gynecology, general surgery, and even joint replacements.
Exactly. Procedures like prostatectomies, hysterectomies, hernia repairs, and even lung surgeries are all being done with robotic help. I actually know a patient who had a minimally invasive gallbladder removal and was back on her feet in no time.
That's the dream for most patients: less pain and a faster recovery. I've heard orthopedic surgeons rave about the precision in joint replacements, too. The robot helps them align everything just right, which can make a real difference long term. So, with all these advances, it almost sounds too good to be true. What are the biggest perks you've seen with robotic surgery?
For starters, the precision is incredible. Those robotic arms move with a delicacy that's tough to match by hand. And then there's the smaller incisions, which means less pain, fewer complications, and much shorter hospital stays.
And surgeons benefit too, right? I've read that sitting at a console is better for their posture and reduces fatigue, especially during those marathon procedures.
Absolutely. Ergonomics are a big deal, but there are downsides we can't ignore. These systems are expensive, there's a steep learning curve, and some surgeons miss the feel of traditional tools. Plus, robots aren't replacing surgeons, they're enhancing what humans can do.
That's an important point. No robot's going to take over the operating room anytime soon. But with all this progress, it's hard not to wonder what the future holds. I'm honestly so curious about where all this is heading. AI is starting to get involved, and there's talk about remote surgeries where doctors operate from miles or even continents away.
Right. And what excites me most is the push for smaller, more flexible robots and better haptic feedback. Imagine if surgeons could actually feel the tissue they're working on, even from behind the console. That would be a game changer.
And making the technology more affordable could open doors for hospitals everywhere, not just the top-tier centers. The day might come when robotic surgery is the standard, not the exception.
It's wild to think how far we've come in just a couple of decades. But at the end of the day, all this innovation still depends on skilled human hands guiding the way.
Couldn't agree more. No matter how sophisticated the robot, it's always the person behind the controls who makes the difference.